Okay, so the topic we're going to discuss now is called pediatric neurocutaneous disorders. We'll start off by talking about which are the diseases that we're going to discuss. The first one is neurofibromatosis 1, neurofibromatosis 2, tuberous sclerosis, and finally SturgeWeber. Before we begin our discussion of the individual disorders, there are first a few facts that we need to be aware of. First of all, the neurocutaneous disorders compose of a set of disorders which include the pathology in the central nervous system, peripheral nervous system, as well as viscera, for example, skin. Most of the disorders you will notice are autosomal dominant, except for SturgeWeber, which is sporadic in nature. That means that it is not inherited. So let's start our discussion by talking about the etiology of neurofibromatosis 1. Now, neurofibromatosis 1 gene codes for a tumor suppressor gene, which codes for a protein called neurofibromin. Neurofibromin is important because it stops overproliferation of tissue, which can result eventually in tumors. So if neurofibromin production is blocked, you end up with increased tissue proliferation in the form of tumor-like masses, which can grow anywhere in the body and which result in the clinical presentation of neurofibromatosis. Now, this mutation is special because this mutation can happen in either all of your cells at the same time, or it could happen in only some of the cells in a localized region of your body. This process can be illustrated in this picture, where you can see that just a specific portion of the body is affected by neurofibromatosis. This is due to a process we call as somatic mosaicism. And this entire process results in a condition called as segmental neurofibromatosis. It is also good to know that the most common cause of death in neurofibromatosis is malignancy. And now we will move on to discuss the clinical features of neurofibromatosis 1. The features that we should be aware of in neurofibromatosis 1 start off with, first of all, café au lait spots, which you can see as hyperpigmented spots on your skin. Hyperpigmented, that means darker than your normal skin. The next thing to be aware of is axillary freckling. You can see these dark spots in the axilla. Another one is leash nodules, which are also called as hematomas of the iris. Next, we have a condition called optic glioma, which is again a tumor-like mass present on the optic nerve. And lastly, we also have the hematomas in the central nervous system. And finally, the characteristic cutaneous lesions of neurofibromatosis are called as neurofibromas. These neurofibromas can be made up of cells like Schwann cells and fibroblasts, etc. And these are divided into two types, the dermal types and plexiform types. The dermal neurofibromas lie within the dermis and epidermis, while the plexiform neurofibromas lie along the major peripheral nerve trunk. And so the plexiform lesions are the ones which distort the appearance of the skin, and they distort the tissue surrounding the neurofibromas. And it is also in the plexiform lesions that we have an increased risk of conversion to malignancy. Other than that, neurofibromas can also cause pain, weakness, and invasion of adjacent structures. Now we'll move on to the discussion of the second neurofibromatosis, which is also called neurofibromatosis 2. And the features to remember in this disorder are, first of all, spinal cord and CNS tumors. The other feature to be aware of is bilateral acoustic schwannoma, which is a tumor found in the cerebellopontine angle in our brains. We can also have cataracts, and the cutaneous neurofibromas found in neurofibromatosis 2 are similar to the neurofibromatosis 1, which means that you can have cutaneous neurofibromas like dermal neurofibromas or the plexiform neurofibromas, just as in neurofibromatosis 1. And last but not least, we must remember that there are no café au lait spots, no leash nodules, or axillary freckling present in neurofibromatosis 2. So if you see any of these three features, you must consider that we probably have neurofibromatosis 1 rather than neurofibromatosis 2. The next disorder we're going to discuss is called tuberous sclerosis. Now, tuberous sclerosis is a disorder in which hematomas are present in multiple organs. So what does a hamartoma mean? Well, it's basically a tumor which resembles the cells from which it originated. So if this is a normal kidney, you will see that a hamartoma looks exactly like the kidney from which it originated from. And if you took a biopsy of that tumor, you will see that the cells are again similar to the original kidney structure, except that in a hamartoma, there is excessive growth of that tissue, abnormal growth of that tissue. And tuberous sclerosis is caused due to a mutation in TSC1 and TSC2. And the proteins that are normally formed by TSC1 and TSC2 are called hamartin and tuberin, whose function is to prevent the overproliferation of tissue. Again, damage to these genes results in hematomas that we see in tuberous sclerosis. The clinical features of tuberous sclerosis can be easily remembered if we correlate each symptom with the organ in which we are having the overproliferation of tissue. The reason we have, first of all, epilepsy is because we're getting tubers in the brain. Tubers are areas of dysplasia. We can have hydrocephalus because we're having a tumor called subependymal giant cell astrocytoma present in the brain, and you can see that it is obstructing the CSF flow. This is what results in the hydrocephalus. We can also have small red nodules on the face, and what these nodules are essentially facial angiofibromas, and they can also be called adenoma sebaceum. We can also have areas of color loss in the skin. Keep in mind, we're talking about areas of color loss here. In Neurofibromatosis 1, we were discussing areas of hyperpigmented skin. Hyperpigmented skin was called as cafe au lait spots. In this case, in tuberous sclerosis, we're talking about areas of color loss, and these are called ash leaf spots. These can be diagnosed using a wood ultraviolet lamp as well. We can also have arrhythmias in tuberous sclerosis, and these arrhythmias are due to cardiac rhabdomyomas, tumors which are growing in the heart. Death can also be caused most commonly in tuberous sclerosis by malignancy of the renal angiomyolipomas. And the last feature that we can also have in tuberous sclerosis is something called shagreen patches, which results in thick, leathery raised patches on the skin. The next disorder we're going to discuss is called the SturgeWeber Syndrome. Now, just as in tuberous sclerosis, hematomas in different organs was the norm, in SturgeWeber syndrome, the disease is characterized by abnormal blood vessel growth, aka angiomas, in different organs in our body. So the features of SturgeWeber syndrome can be understood similarly by understanding that angiomas can happen in these multiple organs, and we can correlate that with our symptoms. So let's start off with the first symptoms, which is the most common neurological abnormality in SturgeWeber syndromes: seizures, stroke. This again can be explained by the meningeal angiomas that you see in SturgeWeber. If you would like to diagnose that, you would ideally be using MRI with contrast. We can also have a port wine colored red stain on the ipsilateral face. What do we mean by ipsilateral face? When we say ipsilateral, we mean ipsilateral to the meningeal angioma. So if the patient has the meningeal angioma on the right side of their brain, we will have a facial angioma or a port wine colored stain on the right side of their face. And this angioma is known to be spread across the ophthalmic nerve distribution on the face. Another feature that we have in SturgeWeber syndrome is called glaucoma, which refers to increased intraocular pressure. Normally, the aqueous humor in the eye is drained via the draining veins present around the eyes, and if these veins are obstructed by, let's say, a hemangioma of these veins, we can have obstructed outflow, and this results in accumulation of the aqueous humor within the eyes and results in increased intraocular pressure, and we can thus have glaucoma. Sometimes the angiomas present in the brain may undergo ischemia, and this can result in features which do not respond to the usual treatments that are given for the seizures, for example, anticonvulsants. In this case, what we can use is some modalities of treatment which are quite invasive but might be necessary in this case. One of them is hemispherectomy. Hemispherectomy mainly refers to the removal of the side of the brain which is involved. For example, if the right brain is involved, the entire or partial portion of the right brain could be removed. In this illustration, you can see that the brain is only present on the right side, while we have carried out a hemispherectomy of the left side of the brain, possibly because the left side was involved. Another treatment modality we can use is something called pulse dye laser, and this is mainly used to treat the facial lesions, and it can help improve the appearance, especially the cosmetic appearance of the patient. And that's about it for today's discussion of neurocutaneous disorders. If you found this useful, go ahead and leave a thumbs up, share it with anyone you think might find it useful, and subscribe to the channel. Till next time.